Hello, my name is Dr. Richard Horowitz, and I am the co-host of the free online Healing from Lyme Disease Summit, June 4th to 10th, 2024. If you are one of the millions of individuals who suffers from Lyme and associated diseases, with chronic fatigue, relapsing and remitting migratory pain, severe memory and concentration problems, sleep and mood issues, and you just can't get better, then during our summit, you're going to gather the tools to get your life back, as you hear from 40 to 50 of the world's experts in tick-borne diseases. One of the most effective ways that I know to get people better is Dapsone combination therapy, a short-term generic oral antibiotic protocol that I developed over 8 years ago, along with finding overlapping causes of inflammation and their downstream effects using the 16-point MSIDS models. What exactly is MSIDS? It stands for Multiple Systemic Infectious Disease Syndrome, and it is a roadmap to success for you to get to your healing destination. You can read about it in the 9 Dapsone publications I have done in the past 8 years, especially in the journal Healthcare in 2018 in Precision Medicine, Part 2. Also in my New York Times bestseller, Why Can't I Get Better? And national bestseller, How Can I Get Better? I have had tremendous success with Dapsone combination therapy and would like to share with you one of the 18 success stories of people who will be interviewed during the Healing from Lyme Disease Summit. These patient testimonials will highlight the safety and success of Dapsone combination therapy and the power of addressing all of the abnormalities on the 16-point MSIDS map. Now, there are doctors and patients that are afraid to use Dapsone therapy because of the potential side effects. These include anemia, Herxheimer reactions, rashes, which only happens in the most highly sulfur-sensitive, as most even with Bactrim allergies can take it, and also methemoglobinemia, where oxygen carrying capacity in the blood is temporarily decreased. As I've been working on improving the safety and efficacy of Dapsone combination therapy for the past 8 years, I can confidently say that this is the shortest oral generic and most effective way I know to get you better. And all the recent improvements in the protocol to minimize anemia and lower methemoglobin levels are in our last publication in Microorganisms, September 2023. So let us now hear from one of the 18 people who will be interviewed during the Healing from Lyme Disease Summit, an individual who is near and dear to me, my wife, Lee. She suffered for years with every chronic Lyme disease symptom that most of you or your loved ones are dealing with, including chronic fatigue, brain fog, dizziness, headaches with migraines and migratory pain. And she's now going on almost 5 years in full remission since doing double-dose Dapsone combination therapy. Lee had every one of the 16-point MSIDS factors that needed to be addressed, including the 3 Bs, Borrelia, Babesia, and Bartonella, leaky gut, food allergies, mast cell activation, POTS, hormonal dysregulation with low adrenal function, vitamin and mineral deficiencies, and environmental toxicity. Yet now she is completely well. Let's listen to her story of healing and hope.
Hello, everyone. It's my pleasure to start us off here. We patients of Dr. Horowitz. I actually had a tough health history in childhood and in my young adult years. I had mono when I was 19 and Epstein-Barr virus in my 20s and 30s. And I had a whole host of symptoms, migraines, digestive problems. I was always cold, tired, brain fog. And then I had the great fortune of meeting Dr. Horowitz and actually marrying him. And that was a really good fortune because shortly after we got married, a few years after, I got bitten by a tick. I never saw the tick, but I had terrible symptoms 2 weeks later and knew beyond a shadow of a doubt that I had Lyme. Turned out I had Lyme, Babesia, Bartonella, all 3, and Mycoplasma. And Rich gave me his best treatments at the time. This was 2001, 2002. And I got better from the antibiotics. I would stop and then relapse. And he would give me again new antibiotics, get better, stop, relapse. Even the herbal protocols I would get a little better and then relapse. So it was, I think it was 2017 that Dr. Horowitz gave me the Dapsone for the first time. I took 50 milligrams for, I believe it was a full year and or 6 months, one of those, and I was well. Stopped the Dapsone, relapsed. Thank you. So then I took 100 milligrams of Dapsone for quite a while, 6 months to a year, and felt well, got off, relapsed. Now, at the time, one of Dr. Horowitz's patients accidentally took 200 milligrams of Dapsone for a month or two. And after he finished that protocol, he was completely well. So I volunteered for that one, of course. And after doing the 200 milligram treatment for 1 month, I was well. I have been in remission for 5 years, almost 5 years. It was extraordinary. During the treatment itself, I had some anemia. I had some shortness of breath upon exertion, but all of that cleared once I stopped the Dapsone a couple of weeks afterwards. That all resolved. And I'm well. I couldn't believe after a month, 2 months, 6 months, a year, that I needed no more treatment, that I didn't have to think about what treatment am I going to do for my Lyme today. So I am so grateful. I'm here to really recommend this treatment from my own experience, having had almost every other treatment in the book, including alternative treatments like the Rife machine and homeopathy and herbs. By far, this treatment is the top. I've never been so well, and I've never not needed treatment for this long. So for all those reasons, I would recommend it without reservation. And maybe because I took the Dapsone for so long, for months and years before the 200 milligram dose, I didn't experience terrible symptoms, just the anemia and shortness of breath. And I didn't even take the methylene blue at the time Dr. Horowitz wasn't giving it. So yes, I would recommend doctors, please give it to your patients. Patients, ask your doctors for this treatment. Let them learn it. Let them learn it. Let them do it. And I think you're going to find a lot of positive results doing this treatment.
You just heard one of 18 stories that will be live during the free online Healing from Lyme Disease Summit, June 4th to the 10th, 2024. During our summit, you'll hear stories of hope and ultimately success of people who have gotten their lives back, and you will see for yourself the power of Dapsone combination therapy and the power of addressing all the abnormalities on the 16-point MSIDS map. You will learn this and a lot more from our 40 to 50 world-class experts who will be presenting during our summit. So please tell all your friends and family about this important summit and join me June 4th to 10th, 2024, so you too can learn how to get your life back. I look forward to seeing you there.